afternoon, everyone. Welcome to H&D's webinar on Fall Awareness Prevention Week that we are sponsoring today from H&D headquarters, Upper East Side, Midtown, and I'm in Westchester. My name is Aaron Huppert. I'm a physical therapist, and I'll be hosting today. We are really excited for today's presentation because, as you know, it's the beginning of fall, and it is Fall Prevention Awareness Week. So it is such an important topic, one that we see all the time in the clinic, and we want to bring some tips to you to help prevent falling if possible. It's a major problem in this country, worldwide. Adults over the age of 65, I think 1 in 3 or 1 in 4 fall all the time, and oftentimes leads to mortality rates. And so we're going to do what we can to help you guys out today with demonstrations and information. And before we get started, though, I'd like you to know that we are recording. So if you miss anything, don't worry about it. We're going to send you the recording in the next week. And if you have any questions, please save them till the end of the webinar, because our two hosts are going to present and then answer questions at the end. So before we get started, let me introduce them. We have Justin Ettinger, physical therapist, director of vestibular rehab, also certified vestibular therapist at H&D Physical Therapy, and Oliwia Juszcyk from the Upper East Side, another certified vestibular therapist who will be guiding us today. So Justin, without further ado, why don't you take it away?
Sure. All right, so I'm going to share my screen. Okay, and I'm Justin Ettinger. I'm the director of vestibular rehab at H&D Physical Therapy. I work with people with vertigo, dizziness, balance issues, falls. I'm at our Midtown location, and I'm here with Oliwia.
Hi, I'm also a physical therapist and vestibular therapist at our Upper East Side location.
All right, so I'm gonna share my screen. We have a little short presentation first, and then we'll get into some exercise. Better balance for fall prevention. It is, as Aaron said, this week is Fall Prevention Awareness Week. We're celebrating this across the country. The first day of fall ushers it in. So welcome, and we have, hope you enjoy this free webinar. So today we're going to talk about the risk for falls, what increases your risk for falls. Also, more importantly, how to prevent falls and to reduce your risk. We're then going to demonstrate and invite you to actively participate in some balance exercises, and then we're gonna have a nice section at the end for like an open forum, question and answer, sharing your stories, what have you. So, why is fall prevention important? Falls are the leading cause of injuries for older adults. This is all from the CDC. Some scary stats, but why we're here, this is important. Right, it's a leading cause of injuries for older adults. 1 in 4 adults fall each year, and 20% of those cause serious injuries. Every 19 minutes, an older adult dies from a fall. And falls are the leading cause of fatal and non-fatal injuries in older adults. Right? Interestingly, women are 3 more times likely to be hospitalized for a fall-related injury, but men are more likely to die from a fall-related injury. Less than half of older adults who fall talk to their healthcare provider about it, and that's a big stat. That's something that we want to change here. And if you fall, you are more likely to fall again. So it's important to try to take action. And it sounds scary, but there are things that we can do to help with this. So falls may result in fractures. The most common fractures you might see with a fall might be the hip, the ankle, the wrist, or the arm. Head injuries can result from falls, and head injuries can be very serious, particularly if someone's taking blood thinner medications. So you should always see your doctor if you hit your head or you fall and hit your head. It's not a kind of let's wait and see how I feel tomorrow or the next day. It's very important. You never know what injury you might have. And falls might result in fear of falling, right? So once you fall, we can get this fear in, and the fear of falling causes us to maybe move around less, to maybe not do the things that are good for us, like walking and exercising, things that could lead to depression, isolation. And then it's a cycle, right? It's the less that we do, the less physically active we are, the more likely we are to fall again. So we're gonna try to break that cycle. What causes falls, right? So let's figure that out now. There are research-related fall risk factors. So some things to consider are just muscle weakness or balance problems, visual impairments, so cataracts, macular degeneration, glaucoma. Certain medications can increase the risk for falls. Just taking 4 or more of any medication has been proven, or 4 or more medications of any kind can have been proven to increase the risk for falls. But certain medications, especially ones that make you drowsy or dizzy, can even more increase the risk of falls, like certain antidepressants, benzodiazepines, and hypnotics. The environment, not having a safe or properly set up environment at home or anywhere can increase the risk for falls. So you want to make sure the home is set up. Improper footwear, like sandals or slippers, something that could increase the risk for falls. And then other things that can increase your fall risk are having a chronic illness, having a vestibular disorder. So the vestibular system is the connection between your inner ear to your brain, to your eyes and your feet. So some people that have dizziness or vertigo might have an increased risk of falls. And then improper nutrition or vitamin D insufficiency could also increase your risk for falls. All right, Olivia.
All right, so as Justin said before, falls are scary, but there's plenty we can do to reduce our risk of falling. So what we're going to do is go over 3 ways that you can take action and, reduce your risk for falling. First thing you can do is make a doctor's visit. You want to make sure that you're scheduling an annual vision exam to check for cataracts, for glaucoma, anything that can affect your balance, as well as check if your glasses need upgrading. Annually as well, you should be getting your medications reviewed. As we mentioned before, you can get drowsy or dizzy from medication. You want to make sure each time you add a medication to your list that your doctor is making sure that there's no drug interactions happening that can affect your balance. Wellness checks, you want to make sure you're checking your blood pressure. Having a blood pressure that's too high or too low can cause dizziness. Checking if your nutrients are all set by getting some blood work done. You can see if you need any type of vitamin supplementation, and getting your feet checked, making sure your doctor can actually recommend footwear for you to see what kind of is going to keep you most steady, and they can suggest if you need a referral to a podiatrist. So the most important thing at a doctor's visit is talking about falls. You want it to be on your doctor's radar when you're insecure about your balance or if you've suffered a fall. It's definitely not something you want to keep to yourself, because you want to talk about it, have it be an open conversation so you can get the support that you need for that. So the next thing you can do is do a home assessment. So you want to make sure that your home is set up to be a safe space for you. So as you can see in our photo here, it doesn't look necessarily very safe to live in that environment. So I'm going to have everyone just think for a moment about some things in their home that might be considered a hazard. And then we'll go over it. All right, think of at least one thing and let me know, or let yourself know, I guess, if any of those things that you thought about are on our list here. One of the main ways that people trip in their home is due to loose rugs. You want to make sure that none of the edges of the rug are coming up and that it's secured to the ground so it's not sliding around. That's a really big way that I hear of people falling at home. Poor lighting. I hear a lot that people wake up at night to go to the bathroom. One thing you can do to prevent tripping when you go to the bathroom is making sure that you have a lamp on your nightstand so that you can flip the light on before you try walking in the dark. Lack of grab bars. So I think it's a good idea to make sure you have a grab bar near the shower, in the bathtub, and near your toilet. Those are all kind of risky areas. And then reducing clutter seems obvious, but it's easy to let things kind of lay around the house and pile up. I know I'm a culprit of that as well. It's a good idea to just take the time to look around and see if there's anything you notice that, you might trip over. Some other tips, you make sure that things that you use commonly are easily accessible to use. So for example, in the kitchen, you want things to be about waist level or shoulder level. Try to avoid putting things you use often above your head because you really, it's not the safest thing to use a step stool. If you do have to use a step stool, it's recommended that you use one that has, a grab bar on it. And the last thing about home assessment is just try to avoid holding on to furniture. I notice this a lot with people, but what it does is it reinforces a bad posture of reaching for furniture, and it causes you to use the things around you rather than what's within you to maintain your balance at home. Good. And the last thing you can do to take action, but certainly not least, is exercise. So scheduling an appointment with a physical therapist or a vestibular therapist, someone who can take a look at, what's going on and give you some recommendations for what type of things need to get stronger, more flexible, and help you come up with what the next thing there is, a multi-component exercise program. You want to make sure that you have the endurance as well to, keep your balance while you're going for a longer walk. Another thing that's really excellent for balance is Tai Chi. It not only physically, but mentally helps you reduce your risk for falling and fear of falling, because what it does is it works on your coordination, your balance, but also on calmness and improving your, relationship with your body and your relationship with balance. And actually, the number one way that the number one method of exercise for older adults is walking. And it's recommended for adults over 65 that they should walk 150 minutes a week at a moderate intensity. So that narrows down to about 30 minutes a day if you're walking 5 days a week. And moderate intensity just means that it's not a stroll, it's more of a brisk walk. You should be feeling like you're, putting in a little bit of work and, working up a sweat a little bit. Good. And then I wanted to let everyone know as well, we do a weekly balance class. It's just like this on Zoom. It's 1 hour every Friday at 1:30. It's free. It includes stretching, strengthening, a little self-massage, breathing and meditation, and of course, some balance exercises. It's myself, Justin, and Sarah as well. And we invite you to join us. And we'll kind of go over actually now a few of the things you can expect at the balance class and some exercises that you can use at home to work on your balance on your own as well.
I'll put a link in the chat later before the session is over today to how to directly access the class on our website.
All right.
Ooh, I don't know how I did.
There's that link.
All right.
Good. All right. So I'll start us off with some exercises. We're going to start with kind of a warm up that's going to work on strengthening your legs and just getting you moving. So all you need is a sturdy chair for this. Okay. So I'm going to just set this up really fast. Okay. So I have my chair here. And you can, everyone can join. These are all going to be perfectly safe for you to do on your own. So the first one we're going to do is called a sit to stand. It's something people might be familiar with. It's kind of like a variation on a squat, basically. So we're all going to start standing in front of our chairs. And there's a couple different ways you can do this. Let's all start by bringing our hands out in front of us. You're going to take a bow and sit down and pop right back up, arms down. Just like that, we're going to run through 10 of these right now. That's 2. If that's too hard for you, feel free to use your hands on your thighs to give yourself a little bit of an extra push.
Feel free to turn on your video if you want to see yourself on the screen so that you can check your form. If you're having trouble with that, let me know through the chat.
You should start feeling your legs getting a little tired. Let's do one more. All right, good. So that's gonna get those thighs fired up. And now what I like to do is alternate this exercise with another one to strengthen your legs called a heel raise. So now what you're gonna do is you're gonna come to the back of your chair that you were just sitting on, and you can use that to hold on to. Good. You can look at Justin's feet there. He'll show you what your feet should be doing. You're gonna hold on to the back of the chair, stand up nice and tall, and you're gonna go up and down on your toes. Nice and easy. Let's do 10 of these together. And you want to control it on the way down rather than just kind of bouncing up and down. You want to go nice and slow so that your muscles are working to control the motion. Good. That's 5. We're halfway there. 6. 9 and 10. Good. And now what we're going to do is run through that one more time. So you're going to come back to the front of your chair. Feel free to take a rest if you need one. Make sure, I didn't mention it before, you're scooting to the front of your chair so that you're kind of perched up on the end there. It's going to make it easier to get out of the chair. So we're going to put our hands out in front of us again. You're going to bow forward and push through the heels to stand. That's 1. And the higher the surface that you're sitting up from, the easier this exercise is going to be. So, you know, if you have a really low chair, it's going to make this a lot more challenging. Let's do about 4 more. All right, and we're up. And now we'll go back to that heel raise again. So we're going to go to the back of the chair. Your feet can be about hips width apart. holding onto the back of the chair, and we're going up and down, up, down. 4. You should be feeling this exercise making your calves stronger. Might feel the muscles tightening there. It's a good thing, means you're doing the right thing. Let's do 2 more. Last one, and down. And we're going to wind down from those 2 by stretching the calf a little bit. So you're going to stay right where you are behind that chair. And what you're going to do is put one leg back, one leg forward. You can look at Justin there. You're going to bend the front knee, and the back leg, you want to glue that heel to the ground. Keep it on the ground. You should be feeling a nice stretch in the back of the calf of the back leg. We're going to hold this just for 15 seconds. And then you're going to straighten the front leg to take a little bit of slack up, and do it one more time. Go ahead and bend that front knee again. The back heel should be glued to the ground so you get a nice, good calf stretch. Going to hold it for 5 more seconds. And now you're going to step the back foot forward. So your feet are together, and then switch feet. So now for me, that's going to be my left leg is back, my right leg is forward. And I'm bending my front knee, keeping my left heel glued to the ground. We're going to hold this one for 15 seconds as well. It should feel like a good stretch after doing those heel raises. Good. Straighten the front leg to take a little slack. And we're going to go one more time, holding for 15 more seconds. Keeping that back heel down, chest up. All right, now put some weight in that right foot and bring your feet together again. Good, so that's a good warm up. And now we're going to have Justin run you through some more balance specific exercises.
All right, so we're going to stay standing if you can. And our chairs, right, can be also used for touching for our balance. Footwear, you know, you want to, for balance exercises, you want to if you're wearing shoes, it should be a supportive shoe. You shouldn't really be wearing sandals. It's not recommended to be doing these in socks because you might slip. Barefoot is also great because you can maybe feel the ground better. So it's up to you, but we recommend if you're wearing shoes, that should be supportive. All right, so we're going to stand next to our chairs. Let's bring the feet together, arms at your side, and we're just going to kind of stand nice and tall. Get mindful of your posture, right? And any times during these balance exercises, the chair is right here for you to touch, right? So if it feels like a good idea, see if you can try closing your eyes, right? And it's totally normal to feel like you're moving around a little bit when your eyes are closed, right? Our eyes, as we talked about before, are very important for our balance. So when we take them away, our brains have to work a little harder. 10 more seconds here, eyes closed. If you can touch the chair, open your eyes when you need to. Then we'll open our eyes. We can separate our feet a moment just to kind of get settled. And then to take that up a notch, we're going to go into what we call a partial tandem stance. Right? So I'm going to turn so you can see my feet a little better. We're going to bring your feet together, but slide one foot a little forward, right? So the further you bring the top foot forward, the more of a challenge it is. You can make it easier by bringing the top foot a little back, right? Ultimately, the hardest exercise with this particular position is bringing your one foot directly in front of the other. So you can kind of choose your own adventure. So I'm going to bring my foot about 3/4 of the way forward. And just looking straight ahead, trying to balance. And then to bring it up a notch, we can try to turn your head a little bit. So we're going to turn our heads to the right and to the left a few times. All right, you're going to follow Oliwia's lead. All right, a few times right and left. The faster you go, probably the more challenge. If turning your head makes you pretty dizzy, then you might want to go slower or just look straight ahead for now. Okay. And then let's come back to the looking straight ahead. Just kind of get settled there. And then we'll try turning our head up and down a few times. And try not to go into any neck pain. If this is uncomfortable, don't turn your head as far. Or you can always just move your eyes if you want. And it shows you what just turning our head does for our balance. Right? Look straight ahead now, kind of get centered. And make sure the chair is close by. I moved mine so you can see me better. We're going to try, if it feels like a good idea, to close your eyes. Right? Not all these exercises are going to be for everyone. It's a balance class. So if something doesn't feel right, don't do it. But I invite you to try closing your eyes. And open them when you need to, touch the chair when you need to. Right? This is not easy. Right, and then let's open our eyes. Right? We can separate our feet. And let's repeat the same thing with the other side. So I'm just going to turn so you can see my feet better. The feet are going to come back together. And we'll slide the top foot, the other foot forward. Right? Whatever foot was forward before is going to be back. And again, the further you go forward, the more of a challenge it is. And it's totally normal for one side to be a little different than the other. We all have different things going on. All right, so we're going to look straight ahead first, try to get your balance. And then we'll repeat the same sequence. So let's try turning our heads right and left. You might notice you kind of drift a little bit or you sway a little bit. Totally part of the territory. And then let's look straight ahead. Trying to regain our balance for a second. And then we'll tip our head up and down a few times. And then let's look straight ahead. And just like before, if it feels like a good idea, we'll try closing our eyes. If it doesn't feel like a good idea, don't do it. All right, so if you're doing it, eyes closed, for 15 seconds. You always can open them if you need to. Touch the chair if you need to. 5 more seconds. All right, let's open our eyes. We'll separate our feet. We'll just pause 1 second here. So if any exercises that balance exercises that cause you to lose your balance a little bit are good for you, right? If you're not losing your balance when you're performing balance exercises, then it's not going to really improve your balance. We want to try to, it should be challenging enough that, occasionally you need to take a step or touch something and then go back into the That's how our brains make changes to improve our balance. So we're going to go into the next exercise. And we'll come next to the chair. Sorry, I'm a little too low. Okay. And we're going to bring our feet about hip width apart, or maybe a little more. Right, this exercise I like to call the shift and lift. So we're going to be working on shifting over to one side and lifting the leg. So first we'll just stick with one side. So I'm going to shift to my left side and pick up my right leg and then put it back down onto the floor. Right, so the chair's here if you need to touch. Right, I'm going to shift to the left, pick up my right, slowly bring it back to the floor. Right, I'm really kind of shifting my weight over to that standing leg and back to the floor. Right? It's not as easy as it looks, right? It's not easy to go slow like this. So if you need to go a little faster, that's okay. If you need to touch the chair, that is fine. Right? This just kind of gets us into standing on one leg a bit. Let's go with 3 more of those. Right? But you can't see my upper body. You can see Oliwia. She's nice and tall. Try not to bend at the waist at all or lose the good posture. 1 more. All right, and then we'll pause there. We'll do the same thing to the other side, right? So I'm going to shift to the right and pick up my left foot and then come back to the middle. Right, again, the slower you go, right, the more of a challenge on the balance it is. So if you need to pick up the pace a little bit, that's okay. If you need to touch the chair, it's okay. This particular exercise, you'll probably notice a difference between the right and the left legs. Totally normal. Really emphasizing that shift over to the standing leg and then control it on the way back down. Let's go 2 more. All right, and then we'll pause there. And let's try to alternate now. Right, so we're going to shift over to the left, pick up the right, put the foot back down. We're shifting over to the other side, picking up the other leg. Right, it's almost like we're kind of like marching in slow motion. But this also, it's kind of how our body moves when we walk. We move subconsciously when we walk. We normally don't have to think about it. We have to shift side to side when we're picking up the other leg to take a step. So if you notice maybe that when you're walking, you might not take big steps or you're catching your toes. Maybe part of the reason is that your balance on one leg is not as good as it can be. So this is a good exercise to help with that. So a few more each side. One more each. And then we'll pause there a moment. Feel free to rest, take your feet up if you like. We'll go into another balance exercise. Now when we started onto the standing on one leg, we're gonna kind of make that now a little more challenging with that. So if you need to touch the chair for the next part the whole time, that is totally fine. So if you're ready, we're gonna come stand next to the chair. I'm getting mine close by for this. So Oliwia, I'm thinking of doing the tree pose. So if you can see your upper body, that would be great. So I'm gonna touching the chair. We're gonna bring the right, kind of stand on your right toe a bit and pivot your right heel so it's resting on the lower part of your left leg. So my toe is still on the floor, but my heel is resting on the lower part of my other leg. Right? Try not to rest it right on the ankle bone. That's not comfortable. You want to be a little bit above it. Right? And we're going to stand up nice and tall, good posture. And we'll see first if you could just let go of the chair if you can, or just kind of maybe one finger, or get the first test. Squeeze your stomach muscles, shoulders back, right? And let's try, if you can, bring your hands to heart center. Right, just like Oliwia is. You can put one hand down onto the chair if you feel like you need to. Nice and strong through the core. This is a modification of the tree yoga pose, which I find is great for balance. Right? If you can stay in this position, we'll see if you can bring the branches of your tree up. Right? You can bring one branch, you can bring 2 branches. You can have one of your branches touching the chair. However you feel like you need, or whatever, anything you're doing, whatever your position you're in right now, we're just gonna hold it if you can for 10 more seconds. Don't hold your breath. Strong through the core and the shoulders and the feet. We'll bring your hands back to heart center. Arms at your side. We're touching the chair. We're gonna let the foot down on the floor. That's a lot of work on that standing leg. So I'm gonna kind of shake it out a bit, give it a little roll. And then we'll do the same thing on the other side, right? So I'm touching the chair to get into position. I'm now on the toe, my other toe, and my heel is pivoting onto my lower leg, right? So I'm trying to find a good grounded position. Stand up nice and tall. Contract those stomach muscles to keep your posture. And then if it feels like a good idea and you can, see if you can let go of the chair and bring your hands to heart center. Right, we didn't think about this before, but think about that foot that's on the ground, that there's roots growing out of your foot, anchoring you down to the ground. Right, your toes are contacting the ground, your heel, the ball of your foot. Right, and we'll see from here if you can, if it feels like a good idea to bring your branches of your tree up. You know, 1 or 2 branches, whatever works, or no branches. My tree is windy. Right, we're gonna keep it strong through your core. Your roots are grounding the trunk of the tree. Excellent. Let's bring your hands back to heart center. We'll bring your arms back at your side and let the foot go back to the floor. All right, we're gonna shake those out. And we're gonna go one more repetition of that. If you feel like you wanna, if that was easy, and you feel like you wanna make it more difficult, I'll show you how to make it more difficult. If it was not easy, then keep it how it was before. So we're gonna go back to the other foot. You can keep it with the version with the toe on the floor, or you can slide your foot up the leg. Just don't go, make sure you're going below your knee. Don't go at your knee. So I'm going below my knee, between my ankle and my knee. Right, see if you can hold that. If you need to keep the foot back to the floor, that's fine. But I'm gonna try it like this. All right, good posture. We're gonna try to bring your hands to heart center if you feel like you can, or one hand. This is very difficult. But a little wobble, a little misstep is not a bad thing for your balance. Just bring the arms up if you can, or the branches. We won't hold it as long. Good, hands down. And then foot back down. Okay, we'll shake that out. All right, if you felt like your foot kept coming down like mine was, that means that probably was a good exercise for you, right? It was causing you have to work a little bit. All right, we're gonna switch to the other leg. Same thing, you can either keep it with that easier position, or you can bring it up if you want the challenge. Just make sure you're not going at your knee, right? You don't want to put the pressure on your knee joint. Okay? So same thing, we're gonna find get grounded through the foot, good posture. And if it feels like a good idea, we'll bring the hands to heart center. Ooh, I am wobbly today. Right. And then see if you can bring your hands up at your trees up, your branches of your tree up. It helps probably to look ahead of you at something, at a target that's stationary, to ground you if you're having trouble. Hands back to heart center, arms at your side. Let's bring the foot back down, shake those legs out there. Let's come sit down a moment, whoever was participating, and we'll do a quick cool down, right? So I'm just gonna lower here. First, oops, I need a cameraman. So I'm sitting at the edge of my chair. hands on my thighs. And we're just gonna do a little stretch of the pelvis and the low back and the core. I'm gonna slide the hands forward, maybe slouch a bit, bring the head down. And then let's slide the hands back, sit up nice and tall. And maybe keep sliding the hands back, squeeze the shoulder blades together, maybe stick your chest out a bit if that feels like a good idea. And we'll come back to the center one more time. We'll slide forward, slouch, tuck your chin. And we'll slide back to the middle. Maybe slide back, bring the shoulder blades back together, stick the chest out, maybe look up. That feels like a good idea for your neck. And we'll get back to the center. I'm gonna turn here. So if it's okay on your hips and your knees, we'll try to maybe give you a knee to the chest, give a little tug there. We can, when we're there, if this feels like it's good for your hips, maybe putting the foot over your knee, letting the knee drop. Mine's a little tight. Wish I knew a good physical therapist. Maybe give a little pull this way. And then feet on the floor. We'll do the same thing on the other side, give a little tug. If any of this doesn't feel like a good idea, don't do it. All right, if it feels like you can, I'm gonna bring my foot over the other knee. A little stretch there, and then maybe a little tug this way to feel a stretch a little differently. And then let's bring the feet on the floor. I'm gonna raise this up. And so we kind of start and end a lot of our balance classes with some breathing or meditation. It's a good way to kind of quiet the mind, but to help us kind of ground us and focus us. So for 60 seconds, I'm gonna be quiet, or I'm gonna try to be quiet. I'm gonna sit up nice and tall, hands on your knees or your thighs. If you need back support, if your back is bothering you, you can sit back in the chair. But if it's not, see if you can get to the edge, hands on your thighs, look straight ahead, soften your gaze or close your eyes. And we're just gonna focus on our breathing. Right, so just trying to focus on the breathing. Maybe the path of the breath. Maybe it comes in through your nose and your mouth. To your lungs and back out. Just feeling the difference of being still as opposed to all the physical activity from before. Trying to let go of any judgments of maybe of how you felt like you performed. Everyone did great. You feel like you're getting distracted, you're thinking about other things, just return to the breathing. So let's open our eyes. And I think we have some more slides, or a couple more. We did that. Sorry. So on a different note, we have just opened our new clinic for H&D physical therapy. We're now in Park Slope, Brooklyn, in this lovely new neighborhood, beautiful storefront. if you're in Brooklyn or you're stopping by, if you're ever in the area, please stop by. We'd love to have you. You can go to hdphysicaltherapy.com for more information, the address and phone number and all that. So we wanted to really finish with some resources. So a lot of the things we talked about can be found from the CDC, the STEADY program. So if you go to www.cdc.gov/STEADY, there's a lot of good information for providers, but also for clients like yourself, including our website, hdphysicaltherapy.com. I will about to put into the chat after I stop sharing. I'll put in the link that you can go to our weekly balance class on Friday. It's every Friday at 1:30. It's free. You don't need to sign up. You just kind of click on the link at 1:30 and we'll let you in. And you can, any questions about like that you guys get after our question and answer session, and you think of it later, please feel free to email Oliwia or myself. I'm just keeping that email up here for now. And oh, another thing flew up there. So now we're gonna kind of open this to y'all for questions, comments, or if you want to kind of share any stories relating to maybe any falls or things that you've been doing to help with falls. So I'm going to stop sharing here.
Thank you, guys. Justin, Oliwia, that was great. I'm looking at the questions that came through. I'm not seeing a whole ton of them. So what I'll do is I'll unmute our participants, and they can either virtually wave their hand or they can just speak out loud. And we'll see how that works. Or you can actually, what it looks like is you can unmute yourselves. That's what it is. Okay, so if you have a question, just unmute yourself and fire away.
So the chairs, hi. Thank you very much. It's Anne-Marie Bernadette. The chairs cannot have wheels, right? Because I couldn't do any of the exercises with you today because my chair has wheels and it was dancing with me. So that would be a bad thing. So I need to be recommended a good chair.
Chair without wheels. Yes. Oliwia, you're muted.
If you don't have a sturdy chair to hold on to, you can stand near your kitchen counter, just something that is sturdy,
okay.
something nice to hold on to.
You know, like to buy
Thank you.
a chair that would work, a good sturdy chair. I've been looking for one.
Justin?
Not a particular chair.
Yeah, just
any chairs that you recommend?
If you if you're comfortable shopping online, just typing in something like standard chair, usually you'll get some good ones. This is the one we use in the clinic. It's your classic standard chair. Looks like this.
Chair.
Yep. Nice and wide,
Okay.
nice and sturdy and comfortable.
Great.
Can I speak?
Yes, please.
I wasn't able to join at the beginning. I didn't get a link until later. Was this recorded?
It sure was. We're gonna send it to our top secret editors, and they're gonna do their magic and then send it out to everybody within the next week. So look out for an edited version of the recording coming to your inbox soon.
Thank you so much.
My legs were extremely weak, I guess because I took sessions today and I couldn't really, it was beyond me to do the exercises. So.
Yeah, well, good job giving it your best shot and, showing up and giving it a try. That's the most important part. Even if you can't do it perfectly, just showing up and trying is great.
Okay.
Hi, I'm Pamela Wolf, and I have a new vision, an impairment that was just discovered. And I see that when I'm walking on the street, especially at night, I feel more secure with a cane because the streets are so uneven. And do you have any other recommendations on with people who have limited vision on how to walk the streets of Manhattan?
One thing that I've seen actually is a cane that has a flashlight with it.
Oh my
So-
gosh.
So
Yes.
that's something as well that you can find online, and it'll help light up, what's in front of you if that's something that you're having a hard time with.
And it's called a cane with brush light?
Yeah, with flashlight, I would look, or just
Flashlight.
cane with
Okay.
light. Mhm.
Okay, thanks. That's a great
Yeah.
recommendation.
Yeah. Otherwise, it can be helpful to just walk a familiar path, maybe if
I do
you know-
that I'm used to, and I know where the bumps and crannies are. So out of memory, but that's wonderful. Thank you. And my other question is that I need a knee replacement. And so I see that one leg is stronger than another. Do you recommend doing ankle weight exercises to build the quads up for balance?
Yeah,
Justin, wanna?
yeah, knee and ankle strength is definitely important for your balance. So if there's weakness there, building that up can help reduce your risk for falls, but also if it's needing a knee replacement, it's a good idea to strengthen as much as you can for after the
Okay.
house replacement.
Thank you.
There was the vision question was great because it sounds like you're on top of going to the doctor and getting that new vision diagnosis. But just a shout out to everyone that hasn't seen their eye doctor in a while, right? It's, as Olivia said, we want to regular visits to the eye doctor. Our vision can change pretty dramatically sometimes if we have
Yes,
certain conditions.
very quickly.
Yeah. So, and it's so important for our balance and for stability and for trying to falls on Manhattan streets.
So Justin, excuse me, is your office still open in Midtown, 43rd Street?
Yep.
Oh, okay.
So
And
Because
are
I
you,
need,
are you at 43rd Street? I'm sorry, Justin, is that right?
I'm at 43rd Street and Olivia is at 88th
Right.
Street.
Okay, 88th?
Yep.
Great, okay.
So we both see people, both Olivia and I both specialize working with people with balance and vestibular conditions. If you feel like that might be you, that depending on if you're going through insurance or what insurance you have, you might need a prescription from your doctor. And then we would get you in for an initial evaluation. Our sessions the first session would be kind of figuring out and testing your balance and your mobility and your strength in various different positions, seeing how you're walking to kind of figure out exactly where you're having the problems, and that'll tell us what exercises and what therapy would be the most appropriate to help.
And your Friday class is at 1:30. You just go to the Zoom link that we went to today and it'll take us there, or is there a different link?
It's a link, I just put it in the chat before.
Oh, okay, I must have stepped away to get water.
Yeah,
So-
it's in the chat.
Okay,
Do you see it?
no, I got to go to more and I don't see, so give me a second.
And you can
Sorry.
always email us as well if you, we can put the emails back up as well. If you have any questions, we could always send you the link.
That'd be
shoot us.
super. Okay,
thank you very much.
Yeah, those are the emails there.
okay.
I saw another question in the chat. Did you see that, Justin?
I missed it.
Okay, I'll read it out loud. It says, can you explain why keeping balance is more difficult when one foot is completely in front of the other, heel to toe?
Olivia?
Can you explain why keeping balance is more difficult? So your balance, when what's called a narrow base of support, makes it more challenging to balance. So when you think about standing with your feet wide like this, you're going to be nice and steady. But if your feet are one on top of the other, walking on a tightrope, that's just going to give you less surface area to stand on and make you feel more unsteady. Is that the question?
Yeah. There are a couple other questions that I get oftentimes. We have a few minutes left here, but before I pose them, does anyone else have any other questions in real time? So can you explain, either one of you, why a lot of my patients tell me that when they get up quickly, they feel like they lose their balance, and what should they do in that case? That's a common complaint that we get. Do you guys have any advice for that?
Yeah.
One might be to don't go so quick.
Slow, go up slowly.
Yeah, exactly. So there could be various reasons why that's happening. You know, one thing could be that your blood pressure could be changing or dropping when you change positions, and that can cause, it might not, for some people they get dizzy. Sometimes people that can just feel imbalanced and they don't even get dizzy. So it's something that if that's happening, you'd want someone to look at to make sure to evaluate that. Other things, it could be a vestibular condition, which is mean the trouble from your inner ear. You know, some people, depending on what kind of dizziness or imbalance it is, it can be, that can also be addressed with exercises and therapy. But in the meantime, regardless of what it is, it's probably better to go a little slower, right? If you're sitting up if you're getting out of bed real quick and you sit up, you know, you want to kind of just hang out there before you stand and walk.
Exactly.
Yes. Anything to add, Olivia?
Thank you.
No, and I agree. And along with that, if that is something that you relate to, it's also a good idea to mention it to your doctor so that they can direct you to, you know, get a better look at what exactly is causing it. But step number one, just try moving a little slower.
Final question for me. I saw in one of the slides, it said the best form of exercise for balance is walking about 150 minutes a day. Was that right? Something like that?
No, 30 minutes a day.
30
minutes a day.
Yes.
150 minutes a week.
150. Thank you. Yes. 150 minutes a week. So
They recommend breaking it down into 30 minutes a day. So it's 5 days a week.
got you. So that said, are there specific shoes that people should wear when they walk, or is it like just whatever's most comfortable?
I always say that just wear whatever you feel most supported in. If you have a foot disorder or any reason why you need orthopedic shoe, I recommend seeing a podiatrist and getting they'll give you, you know, the best recommendations. But normally I say just get a shoe that hugs your heel and something with a wide toe box so that your toes aren't scrunched together, and just anything that, you know, makes you feel most balanced and supported. Anything to add, Justin? Shoes?
Depending on how much you're walking, you want to make sure that you're changing but we're getting new sneakers and new shoes on a regular basis. You know, if you're walking a lot or briskly walking a lot, you probably need to change them more often.
What is that? How often is often? What's your definition?
Like every couple of months would be often, I would think, like every 3 months, but you can get away if you're not walking as fast or as much, then you can probably get away with every 6 months or maybe even more.
And take a look at the bottom of your shoe and you can see if it's really worn out, especially if it's more worn out on one side than the other, then that's probably a good sign that it's time to try to get a new pair of shoes. So So you have better grip and better balance.
And to see an orthotist and seeing a foot doctor as well.
Yeah.
Sorry.
Thank you. Thank you, everyone. If there's no more questions, we'll wrap it up here. This was a really incredible presentation, very insightful, very useful. Thank you guys so much for everything you gave us today.
Thanks for coming, everyone.
Thank you.
Bye-bye.
All right, everybody, we'll be in touch soon. Stay safe.
Thanks, everyone.
Thank you.
You. Thank you. Thank you.